Periodontal disease is infection of the gum tissue and the bone around the teeth. Periodontal disease is an umbrella term for gingivitis and periodontitis. The difference between the two is that gingivitis is infection localized to the gum tissue alone, and periodontitis affects the gum tissue as well as the bone around the teeth. The gum tissue and the bone are like the foundation of your home. It's what supports the teeth in the mouth, so it's very important that it stays structurally sound. However, if plaque and tartar is not being removed adequately enough with proper oral hygiene at home, that is when the infection occurs. Now, periodontal disease, like I said, with gingivitis and periodontitis, gingivitis can be returned back to health with better hygiene. Periodontitis, however, requires professional treatment by us, your dental team here. What that means is that we would recommend for you to come back for scaling and root planing, which is also sometimes referred to as gum therapy or deep cleaning. What we do at that treatment appointment is use a local anesthetic to make sure that you are comfortable during the treatment, and we mechanically remove all the plaque and tartar sitting at the base of the pocket. Now, we also use instruments that help to smooth the root of the tooth in order to regenerate healthy gum tissue to attach back to the root surface of your tooth. The point and the goal of doing this treatment is to arrest the process of deterioration of the bone. However, once the bone has been deteriorated, we cannot get it back. So all that we can do is arrest the process of deterioration and hope that the gum tissue will heal up nicely and bring the patient back to health. However, it is important to note that periodontal disease does not only affect the oral cavity, it also affects the rest of your body. Periodontal disease affects about 60% of the population and is the 6th most common disease, and it also puts stress on your other organ systems. Because the active infection is running through your bloodstream, it is putting stress on your organs and putting you at higher risk for stroke and heart attack. For that reason, we also want you to know that this is a lifelong disease, something that does not have a cure. So after achieving treatment, we may recommend that you come see us on a more frequent interval than 6 months for your cleaning so that we can adequately monitor the process of this disease.